I'm Dr. Sara Malik, and as a urologist, I've seen the toll that health concerns take on men's physical and mental well-being. For centuries, men have sought ways to enhance their performance, their confidence, and their overall vitality. It's a pursuit often shrouded in myth, frustration, and silence. But what if the most powerful solution wasn't a pill, a pump, or an expensive procedure? What if it was a simple 3-minute daily exercise, accessible to every man, that harnesses the body's own natural mechanics? I'm Dr. Sara Malik, and as a urologist, I've seen the toll that health concerns take on men's physical and mental well-being. The statistics are clear. Insert a factual, shocking statistic here, e.g., nearly 50% of men over 40 report some degree of erectile concerns. 99% of men don't know about the simple biological mechanism that can significantly boost size, hardness, and endurance, naturally. Today, we're breaking the silence. This isn't just a physical documentary, it's a guide to reclaiming your natural health. We're going to dissect the science and share the powerful story of a man whose life was transformed by just 3 minutes a day. To understand the solution, we must first understand the problem. The core issue for many men isn't a lack of desire, but a lack of blood flow quality and muscle tone in a very specific area. Think of it like a garden hose. If the pressure is low, the water stream is weak. The exercise we'll discuss targets the pelvic floor muscles, specifically the pubococcygeus (PC) muscle. These muscles act as the foundation for both urinary function and, critically, erectile function. They are responsible for cutting off blood flow out of the penis during an erection. They are the key to hardness and endurance. Size enhancement. While genetics determine maximum size, consistent exercise of the PC muscle can lead to increased vascular health and tissue engorgement. By strengthening the surrounding support structures, we can optimize the full expression of your potential. This isn't magic, it's applied physiology. It's about building a better hydraulic system. The 3-minute factor. Why such a short duration? Because this is a high-intensity, targeted muscular workout. We are aiming for muscle recruitment and neuromuscular efficiency, not exhaustion. Overtraining can lead to fatigue, but a daily, precise 3-minute session is the perfect sweet spot for growth and tone. It's the difference between a quick, focused set in the gym versus a marathon. So remember this. The path to boosting your size and hardness naturally starts not with an external product, but with an internal commitment to toning the foundational muscles that your body already possesses. This is the science of the foundation. The science is compelling, but the true impact of this exercise is best told through a story. Meet Alex. Alex, a 42-year-old accountant from Toronto, felt the slow, quiet erosion of his confidence. Like many men, he started noticing changes in his performance, a lack of the reliable, effortless hardness he once took for granted. Alex tried the usual suspects: expensive supplements, quick-fix promises online. Nothing worked. The physical concerns started to bleed into his emotional life. "It makes you feel like less of a man," he confessed to me during our first consultation. This feeling of failure led to avoidance, stress, and a growing disconnect in his intimate relationship. His case wasn't complex, but it was common: poor circulation, a sedentary desk job, and critically, an untrained pelvic floor. I explained the anatomy to him, pointing out that his core strength was fine, but the foundation, the PC muscle, was dormant. I prescribed the 3-minute daily exercise. Alex was skeptical. 3 minutes? That's all? He asked. He committed. For the first week, he felt nothing, just a subtle tightening. By week 3, he started noticing small, encouraging changes. Morning erections were stronger, his bladder control was better. But the truly remarkable shift came around week 6. Alex's partner noticed the change first: the renewed strength, the endurance. The mental weight lifted. He wasn't just fixing a physical issue, he was rebuilding his confidence and rekindling his intimacy. He realized the power wasn't in a miracle cure, but in the consistent, deliberate work on his body's core engine. This is the PC muscle isolation technique, often referred to as Kegels for men, but performed with a clinical precision that maximizes results. Step 1. Locate the muscle. The easiest way to identify the PC muscle is to try and stop the flow of urine midstream, or to stop yourself from passing gas. That deep, inward and upward squeeze is your target. Step 2. The hold, the power phase. We will use an exercise method called pulse and hold. Contract the muscle as hard as you comfortably can, pulling it inward and upward. Hold this peak contraction for 5 full seconds. Focus on only squeezing the PC muscle. Avoid tensing your abs, buttocks, or thighs. Step 3. The release, the relaxation phase. Now, fully and completely relax the muscle for 10 full seconds. The relaxation phase is just as vital as the contraction. It allows blood to refill the muscle, preventing fatigue and promoting growth. Don't rush this. The 3-minute session, repeat this 5-second hold, 10-second rest cycle for a total of 12 repetitions. This will take exactly 3 minutes. That's it. Do this once a day. Consistency is the magic ingredient here. You can do it sitting in your car, at your desk, or before bed. The PC muscle exercise is the foundation, but to maximize your natural potential, we must look at lifestyle. Since hardness is fundamentally about blood flow, anything that improves your cardiovascular health acts as a powerful natural remedy. Nitric oxide boosters. Certain natural foods encourage the body to produce nitric oxide, a compound essential for vascular dilation, widening the blood vessels. Incorporate foods like beets, dark leafy greens, spinach, arugula, and watermelons. These are nature's subtle performance enhancers. Stress and sleep. Chronic stress constricts blood vessels and floods the body with cortisol, the enemy of performance. Prioritize 7 to 8 hours of quality sleep and incorporate mindful activities like meditation or deep breathing exercises. Your mind is the body's control center. Calm it, and your body will respond. As a urologist, I must address the misinformation out there. Myth number 1. External devices are a permanent solution. Pumps and extenders can provide temporary cosmetic effects or be useful in specific clinical recovery settings, but if this documentary has opened your eyes to the potential of your own body, I have one request: commit to the 3 minutes for 30 days. Then come back and share your experience in the comments below. Your journey can inspire hundreds of other men who are currently struggling in silence. Do not address the underlying muscular tone or blood flow issue. They are a band-aid, not a cure. If you value clear, scientific, and empathetic health guidance, please consider subscribing to the channel. Hit the notification bell so you don't miss our next deep dive into natural health optimization. Thank you for joining me on this journey to better health. Remember, the foundation of your vitality is always in your control.